This is Section 8, Obesity Management for the Treatment of Type 2 Diabetes. There are a lot of sections that pertain to diabetes because of the multiple issues that can happen and be affecting the patient's life and increasing morbidity and mortality. So it is complicated. So assessment, we should check a BMI and document it at every medical encounter. And that's just part of the vital signs. And if you can see here, this is a really nice table here to show you what kind of treatment these patients should have depending on their BMI. So if they're just a little bit overweight with the BMI 25, 26, then we talk about lifestyle changes. Once they go from 27 to 29, we can consider pharmacotherapy. And then if they're above 30, they're considered obese. Greater than 40 is morbid obesity. Then they can be criteria for metabolic surgery. So that's what we're going to talk about. Lifestyle changes, losing weight is the key to getting rid of insulin resistance or decreasing it as much as possible. Because there are some factors that if you've had insulin resistance for quite some time, you could do permanent damage to your pancreas, the beta cells, and so you can have beta cell dysfunction over long term. All right, so diet, physical activity, behavioral therapy. Think of it as a prescription. You're prescribing that for that patient. Anybody who's overweight or obese, anyone with diabetic. And remember, you have to be ready, and it's all about behavior change, which I've talked about in another video. The high intensity behavior change strategies. And it says here to achieve a 500 to 750 kilocal a day energy deficit. I think that's difficult for the patients to understand. So I usually tell the patient, what do you want to weigh? So however you feel, but number one, you need to do small changes with these people. You can't just say, which I've heard time and time again, and some of it is to a system issue because we don't have a lot of time with patients. So in obesity, teaching, losing weight, and lifestyle changes, it takes way more than 15 minutes. So yes, we refer to dietitians and stuff, but again, insurance doesn't always pay for multiple visits and checking in for accountability. And to tell someone, oh, you need to decrease your calories. Well, some people don't understand counting calories. And now there's so many different diets around, and I like to call things lifestyle changes. If you ever hear someone say the Mediterranean diet doesn't work, the keto diet doesn't work, low carb doesn't work, Weight Watchers doesn't work, it does work. It's not really a diet temporarily. So what you choose needs to be a lifestyle. And so most of the time they'll tell me their story and say, well, when I stopped it, I gained all the weight back. Well, it doesn't mean that lifestyle didn't work. It just means you quit doing that lifestyle. So that's something to really think about. It's what lifestyle do you think is going to fit into your life? And if it's the Mediterranean diet, which has really good evidence that it works, then that's great, but it needs to be a lifestyle change. When I put patients on lifestyle changes, meaning their diet, I say, all right, what's one thing? First of all, I believe in food journals, if they'll do it. Second of all, I say, what's one thing that you think that's your vice? Do you eat after dinner? Nighttime snacking is huge for people. Do you graze food all day? Do you eat too many sweets every day? So I say, all right, let's pick one thing. How about pop soda, or I call it pop here. Pop, I grew up in Illinois. Pop or soda. I drink 5 cans a day. I can't get off of it. All right, well, let's see. Do you think you could go down to a half a can a day for just a couple days and just kind of go down from there? And I have had the most success with doing that. And as far as their food goes, I'll tell them, let's make it easy. Have 4 cups of vegetables a day. Have only a half a cup of berries a day if you're going to have that. And focus on your protein, moderate protein. And I tell them to weigh their food, 12 to 15 ounces total a day of protein. and you'll lose weight. They should be taking some multivitamins, etc. All right, so again, this goes through different types of things like tracking your steps and how you're going to monitor your weight. And again, I ask my patients what kind of where do you see yourself? I don't tell them if they're 250 pounds, and I don't tell them you should weigh according to the scale, you should weigh 150 pounds. Well, that's so overwhelming for a patient. I say, well, where would you like to be? What do you think would be a good goal weight for you? And it may, if they're 250 pounds, they may say, you know what, I just want to hit the 200 mark. Or they'll say, I just want to get to 225 now. All right, perfect. Let's work on that now. And again, that's most successful. For the A recommendations, though, the patients that achieve the short-term weight loss goals, long-term weight management programs should be prescribed. So again, it's all about that continuous ongoing lifestyle. They should have at least monthly contact, ongoing monitoring of body weight, and weekly or more frequently, and self-monitoring strategies, because they're in their own environment without anybody else that's accountable, except they have to be accountable to themselves. I send people to the Medical Weight Loss and Wellness in Racine. They have an Oak Creek place too. It's been open since, oh gosh, I think they're going on 9 or 10 years of being open, and they have basically reversed several of my patients with diabetes. Now they do keto, but my patients have, for the most part, stayed off of their medications and done really well on that specific lifestyle. But again, it's the lifestyle. Now, pharmacotherapy, this is where I'm going to talk about the medications that you can prescribe. Now, the problem with prescribing these, there's risks to all the medications. There's no magic pill, and we need to do extensive talking with our patient that this is temporary and there's no magic pill, and they have to develop some lifestyle changes while they're on the medications, as well as there are side effects, and insurance will tell us that a medication is $300, so a patient is not going to um, most likely pay for that. So for a patient's response to weight loss is less than 5% weight loss after 3 months, then you take the medication away because it's not really working for them. So I'm going to talk a little bit more about phentermine than all the other ones, because that is the most common. It's the cheapest. That's what people come asking for. That's what they want. You will find providers that are completely against phentermine. You'll find providers that give it and just keep prescribing it for years. I've seen that. Or you will see people do short-term treatment and do it the correct way for those patients that really qualify and are willing to have a lifestyle change. I put people on phentermine. I tell them that you can only be on it for 3 months. And if you're not losing at least a pound a week, then I will not refill it for you. And I hate to be that way, but there are side effects, and it's a lifestyle change. I'm doing them a disservice by keep giving them phentermine, because it's just suppressing their appetite. They're probably not getting the nutrients that they are getting because they're just not eating. That's not everybody. But if somebody, let's talk about a positive note. If someone is morbidly obese, you need a boost for confidence, for your metabolism, to get that weight starting to go down while you're changing your habits. So that's where I think phentermine fits in really well. But they are side effects. So I always get an echocardiogram and an EKG on my patients that I'm going to put on phentermine. Now, years ago, there used to be a drug called fen-phen, where like people lost drastic amount of weights, but start causing heart valve problems, or they had to have valve replacement. Phentermine, so there's a component of it, but phentermine has really not had those issues, but it's still safer to make sure that they don't have any issues with their valves before you put someone on phentermine or any cardiovascular issues. hypertension, it can raise that. So someone who already has hypertension, probably not a good candidate for it. Phentermine is also, I say, remember, it's an amphetamine basically, and so it's a stimulant, so it's going to keep you up. And I have patients that would come back and say, yeah, I feel like I have to take it twice a day, it wears off. It's like, well, you're not changing your lifestyle, so we have to think about how we're taking the medication. So that's my spiel on phentermine. So you will decide whether you want phentermine or not. You may work with a collaborating that is a little bit, you don't practice as independently as maybe as you want, and they say, nope, I refuse to do phentermine with my patients and your patients. There's a shorter acting one called phentermine. That is the short acting portion of phentermine. So that's another option. And it's a 35 milligram dose, and they take it 2 times a day to 3 times a day. Whereas the phentermine, they take a 37.5 milligram dose 1 to 2 hours after breakfast. But again, it's contraindicated, or it shouldn't be given with cardiovascular disease. Anyone with hyperthyroidism, and be careful with diabetes. It doesn't mean they can't have it, but it is recommended if you are in the obese range. I think that's it on that. Sorry, I took my notes on that. And there's a reason why they say the 12-week mark, because benefits decline after the 3-month mark. If it's not working, it's probably not going to work. There's another option for phentermine, is you can have them take it intermittently, and no greater than 3 days a week. So say there's a new hype is intermittent fasting, where they're saying that if you intermittently fast, you're not needing to secrete insulin, so you're giving your pancreas a rest. So that's another option. They can use the phentermine on their fasting days. All right, orlistat's another one that is another one that's been out for quite a long time. These you can get. Wait, let me think. Orlistat, I think you can get over the counter, maybe not. All I know is with this medication, because obviously you see I don't prescribe it. This medication you have to eat with a meal, but not high fat. If you eat it with a high fat meal, then you will definitely have diarrhea with it. And you can have issues with absorbing vitamins. It's an option, and it's out there. There's this Locasirin XR. Now look how much money it is. And as you can see here, it has side effects over here. So it's not one that I usually prescribe, because the type of population I take care of, it's not on their formulary. There's the phentermine and topiramate, which is another one. And that seems to be a little less expensive than the other ones. And then there's naltrexone and bupropion. Now, the naltrexone, bupropion is your Contrave. So all of these are still brand name drugs. I'm trying to think what the phentermine topiramate. You'd have to look it up and see the brand name. So the naltrexone, bupropion is used for smoking cessation. So they did some studies and found that, it really does help with overall behavior change and appetite, because of the dopamine area, that's chemical that is affecting the brain. And naltrexone, it's used, the way that it's put together, it's to help you not have the craving for food. There's risk of suicidal behavior and ideation from the bupropion. It's contraindicated with chronic opioid therapy because of the naltrexone. The seizure threshold becomes lower because of the bupropion. So you don't want to give it anybody with hypertension or seizure disorders. And this one here is actually great for diabetes, and it's also now recommended or indicated for weight loss, and that's your Victoza. It's an injection. I think, yeah, that's lutide. I believe it's an injection. And you have to be careful with, if they have a history of pancreatitis, I would not prescribe that. And anybody with thyroid C-cell tumors and contraindicated with a history of, this is a thyroid type tumor. Hold on. No, it's medullary thyroid carcinoma. I'm like, wait, what's that mean again? That's the medullary thyroid carcinoma. This is Victoza, and it is an injection. Metabolic surgery is recommended if a BMI is equal to or less than 40, or Asian Americans with a BMI 35 to 39 who cannot lose weight despite lifestyle changes. So it can be considered, and in order to do that, they have to go through a series of events in order to qualify by their insurance company as well as the surgeon. You have to go on a liquid diet, you have to go through psychological testing, like cardiac workup. So it's a huge deal to have that done. There's different methods of metabolic surgery, though. There's lap band, there's the gastric sleeve. They pretty much do those now instead of the more aggressive ones that they used to do years ago. And it says here you have to make sure that they're ready, because once you do the sleeve and the lap band, which I am not an expert on that, I do know though you have to significantly decrease your calories for the rest of your life. If you don't, it's not really going to work.